Hello, everyone. My name is Jon Cherry. I'm the area sales rep for ScottCare. Hopefully, most of you know me. ScottCare being the industry leader in cardiopulmonary telemetry systems throughout my territory of Texas, Louisiana, and New Mexico. We've got this opportunity now to work more closely with Chanl Health, and I'm going to introduce Barb Fagan and let her explain a little bit more about what it is that they're bringing to the equation so that we can all move forward together collectively.
Oh man, Jon Cherry, that was a great introduction, but what the heck did I do again? Hey guys, this is Barb Fagan. I'm not a cat. Anyways, let me give me 1 second. Let me see if I can get rid of this. 1 second. Hang on. I know I can do this. Ta-da! Did it work?
There you go, Barb.
Am I back?
Yes, ma'am.
Well, this is great. Well, welcome again, everyone. My name's Barbra Fagan. I am not a cat. And many of you know me as a colleague, a clinician, past president of AACVPR. And more importantly, I know many of you as my friend. But recently, some of you have gotten to know me through my work with Chanl Health. And that's one of the things that we're here to talk with you about today. So I'm sure I don't have to remind any of you that this past year has been unlike any we've ever experienced. And it was a little over a year ago that programs closed, staff were often relocated, some of us furloughed, and we learned all kinds of new terms like socially distanced and masks, and Zoom became a household word. But sadly, that left many of our patients with nowhere to go and no support. What we did at Chanl Health was quickly made the decision to offer our hybrid program to any organization and any program in the country at no cost. And the response was overwhelming. We had over hundreds and hundreds of patients connecting to their programs with each other wherever they were. And today, we see light at the end of the tunnel. More and more people are being vaccinated. Programs are slowly reopening, and we're getting back to pre-COVID volumes. And this is all really, really good. But the one thing we don't want to return to is what was. And that is less than 30% of our patients are attending a proven intervention such as cardiac and pulmonary rehabilitation. And virtual care can meet those needs. And quite honestly, they've met the needs of many, many people throughout the pandemic. Heck, I even had a few virtual visits myself. The one thing about virtual hybrid rehab, it was here long before COVID, and it's going to be here long after COVID is just a memory. So I was doing a little research on my friends in Texas, and I found a couple really cool quotes, but I'm going to quote one that is from someone I think most of us love and is near and dear to our heart, Matthew McConaughey. You know, cue Jon Cherry. All right, all right, all right. But what Matthew McConaughey said is, in Texas, there is a certain honor of being a Texan, and that is doing something the best that we can. So I'm going to throw that out to all of you in Texas land, is why not do something better than what we're already doing? What we're doing is amazing. How we're serving our patients in on-site cardiac rehab is a profession that if I had to do it all over again, I would be signing up and be at the front of the line. But again, we can no longer accept 2 to 3 out of 10 of our patients are experiencing this amazing program. So we're here to talk a little bit today about how can we do more utilizing technology, utilizing Chanl Health, and utilizing our partnership with ScottCare.
Well, that was an excellent introduction. I really appreciate that, Barb. Thank you so much. So with that said, in my travels here recently, since our relationship, I've stacked up a few questions that I want to run by you in hopes that they adequately represent, some of the questions and concerns accounts have. I know down here in Texas, after having participated in one of your training webinars up in the Northeast, that the environment's completely different. They sure are busy up there, and it seems like everybody's jumped on board. There's a lot happening, and the group that you were speaking to was coming to you because everybody around them was already involved in your program. So down here, it's a little different, and I'm just trying to get a little foothold on things. And so I would appreciate you maybe going through, let's say, 4 or 5 questions here pretty quickly.
Of course, of course.
Okay, excellent. So one account, I was surprised to hear them say, and I think they were surprised themselves at how busy they are. They, I don't know what their perception was over the last year, but they're now very busy, and they seem very pleased and very relieved to see them, to realize how busy they are. And so now they're questioning if they even need to do anything in the home.
Well, that's a great question. In fact, I get that often. And one of the first responses I have for groups is that a hybrid virtual option is not a COVID solution, and it's not looking at how busy or not busy we are. It's about access. It's about reaching patients who cannot or will not attend on-site cardiac rehabilitation. And we know, again, and it's going to sound like a broken record here, but less than 30% of our patients that are eligible actually attend. The reasons they don't attend are many. High copays, return to work, inconvenient schedules. Oftentimes, most of the time, we expect our patients to fit our schedule. And we know that that doesn't work for everyone. So being busy is great, but being busy does not really contribute to the overall health of our population. So we need to reach more patients. And when you utilize technology, oftentimes there's a fear too that, well, it's more work. It's one more thing for me to do. So I would really ask everyone to think about how we do things, and can we do them a little differently? Can we utilize technology to make some of the things we do more efficient? But the bottom line is, how can we reach more patients? And no longer is it acceptable for us to say, we're busy, we're delivering great care, and ignore the 80% who never walk through our doors. And that's what it's really about, John.
Okay, so that kind of leads me into the next question. How do you address staffing? What's going to be required? How's that going to play out?
Another great question. And, if I would say what is consistent about cardiac rehabs across the world is that they're consistently different. So every program is going to look a little bit different. And when you work with us, we're a whole program partner. So we would come in and work with that group to look at workflow and look at how do you slowly and incrementally bring in more patients. The way I like to explain or describe a new program would be, it's more like a dimmer switch than it is a light switch. And what I mean by that is, if you're launching and implementing a brand new program where you're going to start offering a hybrid virtual option, it's not like on day one, you have 50 more patients. On day one, you might have 1 or 2 more patients, and then 3 or 4 and 5 or 6. So it continues to gradually grow. And most programs can do that in their current FTE. And as they grow, then we work with you to decide, like, when is it that you need to bring in more, not more staff, but when do you need to take some of the staff you currently have and dedicate them to more of the hybrid group of patients. What we have seen is about 0.5 FTE could manage up to 100 patients. And that's what we've seen. So again, it's not like just bam, you flip that switch and we have to have a whole new workflow. It's working with the programs, understanding their current process, understanding how they're going to bring patients in. Because remember too, that a hybrid virtual option is not for everyone, but it is definitely for some. So the staffing issue is always a concern. I was a clinical exercise physiologist. I led programs. I understand the volume of work that we have in front of us, but I also understand a lot of things like work expands time allotted. Sometimes what we're doing is not always efficient. So if you do introduce a new program, there's always going to be some change. So we just want to look at how can we help you manage that change and be as efficient as possible and reach as many patients as possible.
So is it safe to say that once you streamline your efforts, got it all figured out and like the way it's playing out, is it safe to say that we need to be concerned about whether Medicare is going to continue to reimburse or not, or how's that going to work?
Lovely question. Lovely question. It's almost like you just served these up for me like a big old volleyball. So another great question. So a couple things. I think it's fantastic that CMS has agreed to pay for virtual sessions during the pandemic. I believe, and this is my opinion, but it's been supported through comments from my professional colleagues across the country, is that there's a belief that this will be extended. So CMS will continue to extend reimbursement into 2022. And I do know there are efforts to make this a permanent solution for reimbursement. But that being said, that's not where we should put all of the gold in the bucket. So the fact that there's reimbursement now is great, but I can give you a couple examples of programs that have been highly successful, have brought in additional revenue, and have served more patients without doing any virtual reimbursed sessions. So again, that if you think about, we're bringing in patients that otherwise would not come in a hybrid solution, so a mixture of some on-site, some off-site, and those off-site most likely are asynchronous, meaning we're not watching the patient. It's not a virtual reimbursed session that can be there. But our group, the Department of Health in the state of Montana, we're working with them. They had 2 hospitals, both hospitals in 6 months, each brought in, it was almost freakish that they each brought in the same amount of revenue, but each of those 2 hospitals brought in an additional $20,000 of revenue because they were bringing in new patients. Now, one of those patients was a patient that would have gone to onsite. So again, a new patient, and not one of those patients did any virtual reimbursed sessions. So it can be done. It's a very good scenario. And if you think about one of the barriers, actually 2 barriers of why patients don't attend onsite, one of them is high copay, and the other is the schedule. So when you reintroduce a virtual reimbursed session, you've now added back into that mix high copay, because that patient will still have the same copay for a virtual reimbursed session. And it also needs to be done in the schedule or on the schedule of the cardiac rehab staff. So again, that's going to work for some, but for the patient that will not come because of the high copay or cannot come because of the schedule, a hybrid, so mixture of coming on site and then some asynchronous with that connectivity to the staff and the cardiac rehab team, that's a solution that is very attractive to some patients.
So clearly the objective here is to not go into a lot of detail about Chanl and the program and everything associated with why it's better than anything else that's out there. We just don't have the time. And obviously what we hope for is that somebody will reach out to us, contact us, who wants to learn more and give you an opportunity to provide them with a one-on-one demonstration of what Chanl will do. But in the interim, what can you tell us about the interest that I'm seeing out there about people that maybe want to investigate utilizing what they already have in place and maybe just add add to it, maybe do it with their EHR or whatever telehealth type approach they're using now. Can you kind of interject
Sure.
how you can straighten all that up?
Of course, of course. And that's that's a great option and an ambitious option, to say the least, because many organizations have their own innovation department, or they've got their EHR. A lot of programs we work with have Epic. Epic has MyChart. Epic has the Zoom capabilities. So the immediate thought goes to, well, why don't we just use what we have, an existing product or solution, and then the way I look at it is force feed cardiac rehab into that. And the reason I say that is, if you think about, for those of us who have had the pleasure, I say that with a grin, to work with Epic, a lot of times with Epic, they'll take the form and we have to take what we do and fit it into their form. And I like to say with Chanl, and with, even with the VersaCare, the VersaCare was created to make what we do in cardiac rehab just smooth, flow seamlessly. That product, VersaCare, works in tandem with what we do. That's separate. Like if we had to only use a telemetry system and then go put everything in Epic, oh my God, I wouldn't even want to imagine what that would be like. So if you think of what we do with the Chanl Health platform, the platform was created with how we deliver cardiac rehab first and foremost. The core components, the education, everything that we do, versus taking an existing system and then making how what we do fit that existing system. So I think it can be done. There's a lot of cost. And then in the end, I don't think it comes out the way that we would all like it to come out. But here for those who are ready to give it a shot.
Okay, so in closing, let me give you an opportunity to speak to the patient experience. I mean, how are they addressing exercise equipment, or what about those that like to come to the hospital, to the program, and meet with everybody? And I don't know, I'm a little worried about, or some of the folks that I'm visiting with are just a little bit worried about the fact that the patient's not there and they're trying to work with them virtually or over the phone. How do they encourage them?
Yeah, that's another great question, John. The first thing that I would say is on-site, center-based cardiac rehab, that's our tried and true go-to. We want that. We want to always encourage our patients to do that. So let's try and divorce that population from who we're trying to reach with a virtual. So the first question you asked me about, well, what if they don't have exercise equipment at home? Well, I would ask each one of you that are out there listening to John and I talk, right now, when you're working with your patients who come on site, there are many patients who do not own their own exercise equipment. So remember, they're only with us about 36 to 40 hours during their rehab, and they're on their own 5,000 hours during that same time period. So as a good cardiac rehab clinician, we're going to assess what they have at home. And if they don't have exercise equipment, then we're going to come up with an exercise plan and prescription that meets what they have or don't have. So that's part one. We can spend a whole nother hour talking about if you're doing a virtual reimbursed session and how that would look, and with and without exercise equipment. Feel free to call me about that, or go back and take a view of the February 16th ScottCare Spring Forward webinar, because we addressed all of that, and it was really good. The second question, John, I think you said, was about watching the patients. So again, same thing, is if you look at the joint scientific paper that came out in May of 2019, everything that's in that paper and all the research was done on asynchronous exercise, meaning people were not watching those patients exercise. And it was proven to be safe and efficient for those patients with good outcomes. And then the third thing is, our patients want to come see us. They love us. Why, this hybrid stuff, it's never going to work. Again, remember, divorce yourself from the group of patients who you see every day. Because when you look at those patients, if you were to ask them, look them in the eye and say, hey, you're coming here and this is really awesome and we get to see you and it's fun, but we have this other option that you don't ever have to come here. Most of them are going to keep coming to you. Again, remember, it's not the patients who come to us already. That's where we want them. But we are missing 8 out of 10 that never knock on our door, never set foot into our space. We have the ability to do something special with that group of patients. Is it going to be the same as on-site? Not at all, but it's going to be very effective for some. And at the not last year, but the year before in Portland, there was a comment from the award winner, and she basically said, hybrid or home rehab is better than no rehab. And I think if you keep that in mind, we're not trying to replace on-site cardiac rehab. Never will, never have. We just need to reach more patients, and this is one way. So I just ask everyone to have an open mind and think about what we do so well. Can we do it for more people?
Even though I have a degree in exercise phys and spent 9 years in a clinic, and gosh, I don't even want to say how many years in sales at different call points in all hospitals that I've visited over the years. I was pretty taken aback when I started with ScottCare about 9 years ago, and I walked into a few of the different cardiac rehab programs, and the repeated message that I was hearing was, we're the low man on the totem pole. We don't make the money the other departments make. The last thing we're going to be able to accomplish is getting new equipment. Man, I'm telling you, I really had to search deep to find out, is this really where I want to be? Because how the heck am I going to sell anything? Well, to make a long story short, we've done a complete turnaround. There are programs that used to exist in the bowels of a hospital who are now up front in the front of the building. It's a community service. There's so much happening. This seems to me to be an opportunity for these programs to even generate more revenue. If 8 out of 10 patients aren't something they're able to access, every one of them that they are able to access is just going to help their bottom line, right?
Absolutely. Absolutely. And the way I look at it too, John, is it's just another tool in the toolkit. So we have some patients who on-site traditional rehab is perfect for them. We have some patients in some programs across the country that offer an ICR. And now we have some programs that offer a hybrid virtual. So it's really pulling out that certain tool, right? That certain tool that's going to be the right tool for that particular moment. And so again, it's not for everyone, but it's definitely for someone. And I believe that it makes us as cardiac rehab clinicians and pulmonary rehab clinicians, it makes us more relevant. There is a fear that, well, if hybrid and virtual start to demonstrate better outcomes than on-site, that on-site's going to go away. On-site is not going to go away because there's a big pool of patients. In fact, I'm going to steal Randy Thomas's quote, and then I think I'll defer to you to end all of this, John. But Randy Thomas made a quote in the Million Hearts Initiative, which in the Million Hearts Initiative, that goal was to reach 70% of eligible patients and have them enter cardiac rehab by 2022. Well, guys, that's right around the corner. And we're woefully far away from that. But right now, if we took, this is what Randy Thomas said, if we took every rehab, every brick and mortar rehab that we have available in the country today and filled it to capacity, we would still only be able to serve 45% of our patients, and we would have over a 1-year waiting list. So again, we don't even have the capacity to reach 70%. So this is just an innovative alternative delivery model of care to help us serve more patients.
Nice. I think a lot of these programs could surprise themselves with how successful they could be. One of the benefits, to being a sales rep and going in a lot of different programs is that you see how differently everybody approaches what they do.
Right.
And, you take a little piece of gold from everybody. And I just hope that everybody, keeps an open mind, seriously considers what we're all proposing here, and in the benefit of all the patients and the programs and everybody else, that, at least give it a look, take it seriously, take the next step, get yourself knowledgeable, and then make your decision. That's what I think everybody ought to be doing right now. But thank you, Barb. Thanks for this opportunity. It's fantastic. And I really appreciate the TACVPR allowing us this opportunity to visit.
Yep. And thank you, each and every one of you, for all that you do for our patients.
Thank you, everybody.